guys, welcome back to the Friday Q&A. This week, as a follow-up to last week's Q&A, I'm going to talk all about skincare during breastfeeding or lactation. You all have many questions about, well, product X, Y, and Z is a caution not to use during pregnancy. Is it okay to use during breastfeeding? So this is kind of a follow-up to last week's Q&A where I talked all about skincare during pregnancy. If you're new here, welcome. My name is Andrea. I am a dermatologist. Here on my YouTube channel, I have a lot of fun vlogs of my life, as well as recipe videos and skincare videos, skincare Q&As similar to this one and many others in the topics of dermatology. So if that type of thing is of interest to you, then subscribe for all of the fun. But as I said in last week's video, and we'll emphasize here, it's very important that you discuss with your treating healthcare provider, the skincare products that you're using, go over, how you're using them with them, because depending on the surface area that you're applying them, what location on the body you're applying them, could impact recommendations. And so, this is just kind of some general objective information on what we know about how certain creams and things are absorbed. Like during pregnancy, we don't know a whole lot about what is quote unquote safe and not safe in lactation. So we just always err on the side of caution, okay? But again, discuss with your treating healthcare provider what is best for you. I'll start in the kind of first category, which is acne. Acne is a disease which doesn't just affect teenagers, as you guys know from watching my videos. It is pretty common in adults and adult women in particular, particularly flares around hormonal cycles, but it can really be a problem during pregnancy and after delivery and during breastfeeding. It can still be a problem during breastfeeding because of a variety of reasons. You may have been off of acne medications during pregnancy and you don't have them kind of in your system and working in your favor, so the acne is still problematic. It can be bad because you may be switching birth control methods around. Obviously prior to conceiving you may have been using and were on board and helping the acne, and you're no longer using them. Or you're using other birth control pills that are less ideal at helping acne along. That's common actually during breastfeeding. Some different birth control pills may be selected, and you may find that your acne does not like those birth control pills as well as what you were on before. That's just one example. And then your skincare routine changes. Hormonal influences are changing, so there are a variety of factors that, make acne continue to be problematic. Like I said in last week's video, your alpha hydroxy acid face washes, lactic acid face wash, thought to be okay, as is azelaic acid, which is in Finacea. Those ingredients are thought to be fine for acne during pregnancy and lactation. Retinols are what are found in your cosmeceutical kind of serums and things, like Paula's Choice has a retinol serum. All skincare lines have some sort of retinol serum, R-E-T-I-N-O-L. And those, aren't regulated in the same way as retinoids, and they seem very, very low risk and seem to be okay to continue using while breastfeeding. But use your brain, okay? It depends on where you're putting things, okay? If you're putting it on the breast and breastfeeding your baby, that's probably not a good thing. But for the most part, retinols used on the face in limited areas seem to be okay. How about retinoids? Things that you get with a prescription, like Tretinoin, Differin, which you can buy over the counter here, and Tazarotene. Are those okay during breastfeeding? Differin seems to be okay. It's very, very low likelihood that it is absorbed to any significant extent, nor is it likely to be excreted in breast milk to any appreciable quantity. So that seems to be a very low risk. Again, probably why it's sold over the counter. And then how about Tretinoin, which is what is in Retin A. I mentioned last week it is generally advised to discontinue use of topical Retin A during pregnancy because of theoretical risk to the fetus. Now that the baby is born and you're breastfeeding, is it okay to use? Well, you know, because vitamin A is it's a normal component of breast milk, there's always a concern that, you know, that retinoids can concentrate in breast milk. Vitamin A concentrates there, so what about retinoids that we're applying on our skin and are absorbed into our body? The amount of absorption is so low from the skin, the transcutaneous absorption, it seems very unlikely that it is present in breast milk. So it's generally thought that, you know, for treatment purposes, as your healthcare provider might advise you, that it's okay during breastfeeding. But again, exercising caution depending on the location that you're putting it, not putting it on the breast, and you know, you wouldn't be wanting to coat yourself head to toe in tretinoin. So you know, using it on the face, it seems to be probably safe, and most healthcare providers feel comfortable that it's okay during breastfeeding, but again, discuss with your treating healthcare provider. Tazarotene is another prescription retinoid, or Tazorac. Tazarotene, yeah, it has about a 6% transcutaneous absorption. Theoretically, it's a lot lower risk because it is less lipophilic or fatty loving. It's active metabolite as compared to other retinoids. So it's theoretically very low risk, but again, caution is advised, and it's not recommended that it be applied to more than 20 to 35% of an individual's body surface area. So in general, the retinoids thought to be okay during breastfeeding, bearing in mind the means of application and the extent of body surface area applied overall seem to be okay. And then there's a drug called Spironolactone, which I have a whole video on Spironolactone for hair loss, but Spironolactone is, and I also mentioned it in my hormonal acne video. Spironolactone is a drug that is often prescribed in women for hormonal acne. It can be very, very helpful. It is contraindicated during pregnancy because it can have negative effects on the developing fetus. However, is it safe during breastfeeding? It is thought to be safe. Consensus opinion says that it's safe during breastfeeding and okay to use. There is a theoretical risk that it would affect milk production because it does kind of influence it does kind of, you know, interfere with some of the hormonal signaling and receptors. That's kind of how it works in hormonal acne. But that doesn't seem to pan out to be the case. And women don't seem to ever, you know, complain of difficulty with milk production while on spironolactone. Salicylic acid, or BHA, is another one that you may be wondering about, and the jury's kind of out on that. It seems to be okay in you know, your over-the-counter acne washes, 2 to 3% seems to be okay. However, much higher percentage than that, like what you would get with a prescription, is generally not advised during breastfeeding because of the theoretical risk of systemic absorption, and it would, you know, get into breast milk, and, you know, your baby could ingest salicylates, which are, you know, similar to aspirin, and subsequently have, you know, aspirin kind of toxicity risk. So it's generally not advised over 2 to 3% concentration of salicylic acid, and it should really be limited as far as how much is being used. So not like, again, bathing in salicylic acid, that could be at risk. So that's one that to really talk with your treating healthcare provider about. Find out what salicylic acid face wash it is that you've used, or salicylic acid product it is that you've used. If it's a leave-on, if it's a wash, and the extent of surface area that you plan to use it on. Then the other concern during pregnancy, like I mentioned last week, and around pregnancy and breastfeeding with all the hormonal influences, is worsening of or new onset melasma, hyperpigmentation, dark spots. And so all of the standard treatments have to be stopped during pregnancy, namely hydroquinone. So you should know that hydroquinone has about a 35% transcutaneous absorption, meaning across the skin. So it doesn't seem, though, that it would concentrate in breast milk or have any untoward effects on the baby, but it's hard to justify the use since it's pretty much prescribed for a cosmetic condition. But talk about it with your healthcare provider. I mean, like I've said on my channel before and emphasized to you guys, having, you know, a disfiguring skin problem, you know, melasma, discoloration, acne, you know, this kinds of things can really help, can really impact your self-esteem. And you're in a fragile state as it is with a new baby who's like crying all of the time. The last thing you need is another factor in your life that's going to make you, feel a little down and out. How about sunscreen? Well, sunscreen is always a good idea. Sunscreen is imperative for melasma, hyperpigmentation, dark spots. Safe to use, particularly zinc, titanium dioxide. Sunscreens are fantastic for, concerns related to melasma, hyperpigmentation, and necessary, okay? They're necessary for anything else to work. They're necessary to improve the hyperpigmentation concern. They're an essential, and they are safe during pregnancy. They are safe during breastfeeding, so. And then another concern that frequently arises postpartum is hair loss, postpartum hair loss. So is it okay to use Rogaine or minoxidil? And the good news is it is. Only 1.4% of Rogaine is absorbed systemically. Rogaine, topical Rogaine or minoxidil, they're the same thing, are fine to use during lactation. Just as in during pregnancy, I think during around the time of breastfeeding and when babies are, you're bonding with your baby, I think it's, you're in a vulnerable period of getting misled by a lot of marketing claims that a product is, quote, far, far safer than another competing brand because it's, all natural and doesn't contain toxic ingredients. And, be a smart consumer when reading that claim because, where's the evidence for that? I mean, like I said in my pregnancy skincare video, there's these companies aren't going out and like feeding babies their fragrance mix and finding out if it's toxic or not. So that's kind of a lie. It's kind of misleading. Those studies don't occur. They don't exist. And so they're kind of just leading you down a path of spending more money on something that you probably don't need in the first place. And I think when your skin is either, flaring in acne or you've got melasma, it's just not where it was. And given the fragility of the setting of a new baby, I think it can really leave a woman who is just delivered and is trying to go through breastfeeding or wondering about how to feed the baby, not even breastfeeding. I think it can really leave a woman feeling as far removed from who she has ever been, and I think that has got to be an incredibly terrifying thing to go through. So, and not knowing what you can do to get yourself better, I think that adds insult to injury. So I really hope that this video and the pregnancy skincare video was helpful to you guys, because I can only imagine. I've never gone through it myself. Simply as an outsider looking in, as somebody who has worked with pregnant women, to me it seems like both an incredibly rewarding time as well as an emotionally taxing and draining time. So there are two ends to it that I think are important to appreciate, and the new parent can really just start to feel a little wrung out. The new mom, the new dad, the new grandparent, from lack of sleep, flaring skin disease, crying baby who can't communicate. There are a lot of factors going on. So I hope this video kind of is helpful. I know the information is incredibly confusing, misleading. There's a lot of uncertainty, and you just want your skin to get a little better so you don't have that to focus on, because you've got all of your attention is being directed at this little person. So hopefully this video was helpful. If you liked it, give it a thumbs up, share it with your friends, and as always, don't forget, sunscreen and subscribe. I'll talk to you guys tomorrow.